I am just going to give everyone a few minutes to hop on, and then we will get started. Okay, so today in my web series, Laser Focus Skincare and Devices, we are going to be talking about dermaplaning. So I don't think a lot of people know what dermaplaning even is. Dermaplaning is a manual exfoliation using sterile surgical blades to gently remove vellus hair and peach fuzz. Vellus hair is not necessarily the same as those thick, wiry, dark colored hairs. Those are called terminal hairs. And this also helps remove the dead skin, which is known as the stratum corneum. It is the top layer of the epidermis. So it kind of sounds like we're shaving your face. And in a way, we are, but in a very professional setting. So the surgical blade that we use is called a 10R blade from Dermaplane Pro. Dermaplane Pro is the preferred product line we use because they are guaranteed. They use a ton of science to back their products, and they also focus on training and education. So all of us at the spa are certified to Dermaplane, but it's different for each person. I personally love to dermaplane, and so I do it very often. So I'm pretty comfortable with my blade. Um, we're not necessarily just shaving off the peach fuzz. We're exfoliating that top layer of skin, whether it is with the blade or with a new peel. So it's done in a professional manner, and it's also going to help remove any buildup on top of the skin rather than shaving, which just removes the hair. So, what are the benefits of dermaplaning? Smoother skin, you're going to look brighter, increased product absorption. When we are using products like brightening serums or even hydrating products, sometimes that top layer of skin, which is the stratum corneum, is dry and dull and kind of textured. You can almost feel when you need to exfoliate. If that layer hasn't been exfoliated off recently, you're going to notice that you might feel hydrated or your toner might work for a few hours, but then you're starting to notice some oil production or maybe lack of oil production, you're dry again. That's part of the reason dermaplaning is so beneficial. When that top layer of skin is not healthy anymore, your skin barrier is trying to combat whether it's too oily or too dry. So just removing that layer that needs to be exfoliated will not only increase the product absorption, but increase the efficacy of your products. This is also going to make any makeup or sunscreen application more even. So a lot of women will notice and tend to notice more often after dermaplaning that you're getting close to needing it again because when you start applying powder or specifically tinted sunscreen, it's going to catch on that vellus hair, the peach fuzz. Now, it's not the biggest deal, but if you can look brighter and more glowy, why wouldn't you do something about it? So those are some great benefits of dermaplaning. That being said, dermaplaning is still not for everyone. If you have an active infection, if you recently had an ablative treatment, if you recently have had a chemical peel, um, my Accutane clients, or which is a prescription medication for acne, or patients who are starting retinol or a pigment control series tend to have a lot of dryness and irritation. We don't want to further scrape up any skin that's sloughing because of these products. Those products are intentionally speeding up the skin cell turnover, so hyperexfoliating can actually cause more damage. And it's also just really hard for us to do it effectively when we're catching on dead skin, or if you have pustules. Everyone knows what a pustule is, they just don't call it that. It's one of those pimples with a white head that just looks like it's about to pop. If we were to dermaplane over that, we would be spreading the bacteria. So we want you to have little to minimal breakouts, no sunburn, and no Accutane starters. And as long as you've been on your retinol, it's safe, but we need to have kind of time it out. Okay, so what does the procedure of dermaplaning really look like? So as long as we've gone over all of the contraindications, you're not burnt, you're not peeling, we get you in. So you come in. I like to use steam to start with my double cleanse. Double cleansing ensures that I'm not only getting any dirt, makeup, but I'm also helping get the skin's pH to the level that I'd like it to be. We learned in my last web series, we like it to sit at like about a 4.5 to 5.5. And so through the cleansing and the prep process, which is known as an AHA BHA prep, we're putting the skin at a level that's safe for us to perform any treatment. So we double cleanse, usually with a foaming cleanser or a gentle cleanser. It just depends on what your skin type is. If you are someone who is chronically dry, we're going to use a hydrating cleanser because we don't want to over saturate the skin and dry you out more when we're supposed to be doing a procedure that's helping the skin. So after our consult, we'll double cleanse with steam. That's also going to help break down some of the stratum corneum, that top layer of dead skin on the face, to prep it to be removed. We then use the prep, which I do not currently have, to get the skin at the right pH. It's kind of the same concept as a toner. We're going to get the skin at the right pH so that we can apply the oil. So it sounds counterintuitive. We just cleanse the skin, and then we're putting oil on it. Not all oil is comedogenic. Comedogenic means acne causing or potentially congesting the skin. In fact, some oils are actually really great for the skin, and there are a ton of oil-based products that we love here. The Nourishing Dermaplane oil from Dermaplane Pro is what I prefer to use. We also use what's called a priming oil. That's from Epion. They feel really soothing on the skin, but this is also going to give us slip. So just like it sounds, oil kind of creates glide on the skin. When we're using the dermaplane blades, we're not necessarily scraping at a 90-degree on top of the skin. And I'll show you a diagram of this later. But rather than being 90-degree horizontally, we're at an angle so that we can lift the vellus hair and the dead skin up. And if we were to do it on dry skin, it could be potentially more irritating and just a little uncomfortable. The slip is there to make my job easier, but it's also there to make it more comfortable for you while I'm doing it, because we do perform this from right under the neck, or right under the chin on the top of the neck to the top of your forehead. So once the slip is applied and we've got a pretty saturated surface, we'll actually begin dermaplaning. The dermaplane process doesn't take long. However, all of our faces are shaped differently, and we all have peaks and pits. And so the typical places to start are the forehead or the chin. The chin is a little tricky to dermaplane, especially if you're with one of us who likes to chat, and I think all of us at TrueBody like to chat. And so we usually try and be quiet because this is still a surgical scalpel. We could cut the skin, which we do not call it a cut, we actually call it a nick. We could nick your skin at any point in the service. So safety is a really big concern here. I personally prefer to start on the forehead. It's the easiest, and it kind of gives me an idea of how your skin is going to react. So begin by holding a section of your skin taut and doing almost a back and forth gliding motion. We do about 5 or 6 passes, and then we move on to the next section. We move in very small sections because our blades, just like any surgical scalpel, are pretty small. Um, the smaller the area, the harder it is to dermaplane. But these scalpels, as you can see, are not even the size of the palm of my hand. So our handle is what we're really holding on to. However, the surface area that we dermaplane is small, and that also helps us be very precise. So depending on who your provider is, they might start at the bottom up or work their top down. Dermaplaning is done even up near the sideburn area, and that's typically where a lot of women start to get peach fuzz. So we like to really make sure that we're covering all of our bases. After the dermaplane, we take a steam towel or fresh sponges and remove all the oil base that was left over. Depending on what my client's skin type is like, I often do a cleanse in between this step because I don't want any bacteria, dirt, debris, makeup that might have been pulled out of the skin, or vellus hair that's left over on the skin sitting there when I apply the new peel. So we'll cleanse or we'll just wipe the face down, and then we apply the new peel. The new peel is also another step in the Dermaplane Pro series. So the new peel is super important because it's a very light enzyme peel. This is going to not only pick up some of the dead skin that I missed while dermaplaning, because we're all people and sometimes my pressure is not as even, but this is also going to help treat the skin. So it's really great for acneic clients. It's also got really great natural enzymes in it, like papaya extract, to help treat the skin on a deeper level. It's stimulating, so it'll help stimulate some collagen and elastin, but it'll kill any bacteria that's there as well. So it is applied as a gel, and it's very cool at first, but because it is an enzyme, it can feel tingly, especially because we just dermaplane you. Dermaplaning removes that top layer of dead skin, so your skin's very fresh. So feeling a slight tingle is totally normal. It should not be burning by any means, but the gel is applied, and then we get to hang out for 30 seconds to a minute, depending on how long and how well your skin absorbs it. And as you wait, you'll start to feel the gel become a more watery consistency. This is because the enzymes are working with everything on your skin and in your skin to help break down those dead skin cells that I removed or attempted to remove. And at that point, we kind of vigorously rub, which sounds uncomfortable, but it's really not. This is going to pill up any of that skin dirt debris that I missed. It is so, so satisfying, and that is 90% of my clients' favorite portion of the facial. Don't get me wrong, it is so satisfying to see all of the dead skin and hair on my little cotton round once we're done actual dermaplaning, but the satisfaction of the fresh skin that you feel after the new peel is crazy. This is actually something that I've added on to other facials because I felt like my clients could use a little touch up, but weren't quite ready for a dermaplane. So you remove that with a gentle cleanser, some steam towels to get your skin feeling good again, and then we'll do some aftercare products. Dermaplaning is considered non-invasive, and it's also considered no downtime. So it's a really, really great service for during the summer. However, that does not mean that we are not making your skin potentially photosensitive. Photosensitivity happens with almost anything that you're going to put on your skin, especially post-facial. Most facials are exfoliating and they include active ingredients, which is great because you're treating the skin while also giving your skin a nice glow, or maybe helping the dullness, especially during the summer. But photosensitivity can lead to sunburns. And one of my biggest pet peeves, especially during the summer, is to hear my clients say, "Oh my gosh, my skin feels so great. I can't wait to go on the boat." Oh my goodness, you are going to burn. So every patient who walks in the door for a facial, whether it's dermaplane or not, leaves with SPF. Not always our favorite thing. However, it's super important. And this is going to help maintain the longevity of your results. So your finishing products will always end in SPF, but they all include a little bit of a different regimen because we want to supplement the skin with products that your skin needs or are applicable to the skin routine that you use at home, whether that's for oily skin, acne skin, or dry skin. we kind of follow suit dependent on what you use. So you're going to leave feeling so refreshed, which is the point of the entire dermaplaning facial. So in this slide, it kind of explains what dermaplaning looks like on a cellular level. So like we learned last time, there's the layer that at the very bottom looks like almost a little popcorn. It's the fat layer. And then that huge middle layer is the dermis. The top layer, which is like a dark pink to the very top where you see the vellus hair, is the epidermis. So we are not removing all of the top layer of the skin to the middle of the epidermis. That is very dangerous. And that would be considered an abrasion or a nick. We are just removing the very top dead skin cells. So in that middle section, you can see with a very poorly angled dermaplane blade, the skin looks maybe a little less dull and brighter, but the vellus hair is also gone. It's not completely removed. As you can see, there are still hair follicles with hair in the follicle. This is not going to be a permanent form of hair removal, and this is also not going to remove the hair from the follicle completely because we are just cutting the hair. So that kind of leads me into one of the biggest myths with dermaplaning. Some people feel that when you dermaplane, it will grow back darker or thicker. Nothing I could do to the top layer of your skin, which would be dermaplaning, would physically change the hair follicle. Vellus hair is vellus hair because it has been not affected by a certain hormone. When a hormone changes, you can change, or the hair follicle can change to a terminal hair. Terminal hair is the hair that we have on our arms, our legs. Some people get it on their face. I have a lot of PCOS patients who have terminal hair on their lower chin, their cheeks, their jawline, even some people on their neck. Dermaplaning is not super suitable for this area only because you're more prone to ingrowns or folliculitis. But we have treatment for that. However, that is one of the biggest misconceived adverse reactions of dermaplaning. Nothing I do on the top layer of your skin will make your hair grow back thicker or darker. That being said, I have a lot of patients who are like, oh my gosh, my skin felt great, but I noticed the peach fuzz again. It could feel like it's more noticeable now, but that's only because you had so many weeks of really great glowy skin with no peach fuzz. So keep that in mind. The next slide is one of my favorite pictures of all time. My sweet Megan, I love her so much, allowed me to dermaplaning her face the other day just to give you guys an idea of what dermaplaning looks like on a real person, because talk is easy, but seeing the results themselves is kind of where the proof comes into the pudding. So this is two pictures of the same area. The picture on the right, where my little true body symbol is actually the first pass I did on her. You can see I kind of did a little rectangle there. You can visibly see where there's no peach fuzz. And you can also see the difference in tone. Now, it's kind of cut off, but over by her ear here, I missed some makeup. There is no makeup on her cheek or jawline. We double cleansed, just like I always do. The difference in skin tone is because my sweet Megan loves the sun, and she's not the best about sunscreen. Everyone needs to boo her and tell her she needs to start wearing it because we tell everyone to wear it. However, she has UV damage, a tan. As you can see in the picture on the left has no flash. That is just generic spotlighting. The right has flash. As you can see on the left, Megan's a very tan person. So when we're exfoliating that top layer of skin that's dead and tan, you're going to notice a bigger difference in contrast from where I didn't dermaplane and where I have. I call it a line of demarcation. It kind of helps me to see where I haven't hit your face yet, and it's great. The picture on the left has a considerable less amount of hair, only because when I took the first picture with flash, I didn't think that people would believe that I really got this much hair off Megan. So we took them off to make it feel like you could see the difference a little bit. But that first picture on the right genuinely is what I got off her face in one pass in that section of dermaplaning. And you can ask Megan yourself when you come in for your dermaplaning, It feels so refreshing even after that first pass. This was before we even did the new peel. So the results are there. They're super, super easy to achieve. And this is applicable for all skin tones and types. So, well, minus acne patients. However, no matter if you're pale like myself or tan and dark like Megan, this is a service that's going to not only help treat the skin, but maintain results. Whether you are an ablative laser patient, whether you are a chemical peel patient, or you are just starting your medical grade skincare, this is something that we can use in between treatments with the correct product regimen to maintain any results. Um, so, again, some myths. The hair will grow back thicker. Oh, my favorite one is I had really great skin, but it caused a breakout. The only reason dermaplaning would cause a breakout is improper technique. So if I were to go over active acne, or if I were not to use sterile procedure, now that's a little misleading because my whole tray of products that I use is not sterile, but the blade I'm using itself is sterile. So there are tons of brands of at-home dermaplane blades. I think the Tinkle razor is like the most popular, which sounds insane. Um, they aren't necessarily advertised as multi-use. However, when you get a pack of two, it kind of is misleading. Those are one, not only dull, so you are going to cause multiple abrasions on the skin, but they are not meant for reuse. So no matter how much you rinse it off, there is always going to be bacteria harbored on that device. So if you were to use it and say you had bacteria then, or maybe you didn't, but bacteria start to grow and you used it again, you are putting the bacteria in that freshly exfoliated skin, causing a breakout. So, I will not cause a breakout on you. It can happen if we have active acne, and that's just something we have to discuss with my acne patients. But I will not intentionally use improper technique, meaning reusing blades or on any patient or using blades that are meant to be reused because that's just not safe. Um, in conclusion, dermaplaning will give immediate results by removing vellus hair and dead, dull skin, increasing product absorption with zero downtime. This is also a service that can be paired with other services such as chemical peels, red light therapy, and so much more to customize and optimize each patient's results. So some of you had asked me about the Bio Repeal. The Bio Repeal is a TCA peel with no downtime. It's really, really great. It's actually an Italian product, I believe. We love it. I do it on Betsy. She doesn't get in as often as she should, but we pair it together. It does affect the efficacy because we're kind of removing that dead layer on the top. Your peel is able to penetrate a little bit deeper. So there are tons of services like the red light that we can pair this with. Um, it's honestly a really, really great service, and it's super applicable for almost any skin type. So let's talk about what we can do with this. Um, any person who is tuned in today or tunes in within so many hours will get the 15% off. If you're a VIP, your VIP discount will supersede that. So if you are someone who is on the Emerald, your discount for that will take over, not just the 15. And then my VIP patients will also get free red light during the service. We have two different red light devices here in office. We have the Soluma and we have the full body red light. Unfortunately, I cannot move the full body red light into the room, so we will just be using my Soluma, which is your face and neck. Really, really great, and it's also going to help with that inflammation post-service. So I love pairing them together. It's a really, really great summertime facial, especially after all of us have been in the sun and outside. And a little bit more about our VIP memberships. We have multiple tiers allowing you to pay receive discounts on services. So this is banked into your account personally. The money doesn't go anywhere. And because you're banking money on your account with us, you receive a discount according to what level you choose. This is really great for my clients who are on a skincare regimen or an acne protocol or HRT therapy patients who are looking to start, whether it's aesthetics or facials or injectables. And everyone should consider being a member because the perks are just crazy. And oftentimes we do really fun stuff for you guys, even outside of the spa. So if anyone has any questions about dermaplaning, I'm going to go back over to YouTube now so we can go onto the chat and see. I'm going to move my notes here. And I am not seeing anything so far. So I think we are pretty much done here. If you guys have any questions or concerns or are not sure if dermaplaning is a service for you, just give us a call or send us a text. I would love to just answer any questions that I missed. And I hope to see you guys in for your dermaplane this summer.